Yeah, just have a few opening remarks. So thanks for coming, everyone. So good afternoon. My name is Dr. Jazz Atwal. I'm the Deputy Chief Provincial Public Health Officer for the province of Manitoba. I have a few comments to make before we open things up for a few questions. Since the pandemic started, Public Health has been advising Manitobans about self-isolation. COVID-19 spreads easily if given a chance. This is why it is important to self-isolate and get tested when symptoms develop, or you are advised by a public health official to go for testing. Not self-isolating can lead to spreading the virus to those around you and to your community members. Currently, household members without symptoms do not need to self-isolate if there is a symptomatic individual or asymptomatic close contact in their home while they are waiting for test results. The symptomatic individual or asymptomatic close contact needs to stay in their own room and, if possible, use their own bathroom and not use common areas. It is recommended that household members wear a mask and physically distance where possible when outside the household in circumstances, and avoid leaving the home for non-essential reasons. If the close contact becomes symptomatic, all household members, unless otherwise exempt, should self-isolate until test results are known or advised by public health. Exemptions from self-isolation are in place for individuals who are fully immunized or recently infected with COVID-19 in the past 6 months, per public health. Currently, the following people are required to self-isolate related to COVID-19. People who are not fully vaccinated and have recently returned to Manitoba from domestic or international travel. People who have been identified as a close contact to a confirmed COVID-19 case. People who share a household with a COVID-19 case who is currently isolating at home, and people living with symptomatic household member who is self-isolating due to exposure to a confirmed COVID-19 case or recent return from domestic or international travel. Today, of the 66 cases, 24 were in Southern Health, Centre Sud Health region. As a result of increased community transmission and case numbers in Southern Health, Centre Sud Health region, public health officials are implementing stricter household self-isolation requirements for this region. This will include household members of close contacts or symptomatic people who have not had any known COVID-19 exposures must also self-isolate. The online screening tool will provide guidance on the timeline for self-isolation. Public health officials will also provide this guidance during the contact tracing process. The change means that a person living in Southern Health Centre Sud needs to self-isolate and get tested, and the rest of the household has to self-isolate unless otherwise exempt. As an example, if a Southern Health student is symptomatic or if they are identified as a close contact, their siblings should self-isolate until their test results are known, unless they are fully immunized or recently infected in the past 6 months, as per public health. This includes not attending school. If the household member is a teacher and not immunized, they could still work if they are asymptomatic and participating in the regular rapid testing program. Fully vaccinated or recently infected people will be exempt from this requirement. If the worker or close contact in the household has symptoms, the exemption does not apply. This guidance is effective immediately and will be in place until the community transmission in the region decreases or when the current strain on the healthcare system capacity is reduced. There have been a number of media requests related to seasonal flu. It is that time of year again. More than 60% of the 2021-2022 influenza vaccine has arrived in Manitoba, and delivery has been completed to the majority of priority locations such as hospitals, long-term care facilities, and First Nations communities. Delivery to other locations such as physicians' offices, pharmacies, and clinics has also started. During the 2020-21 flu season, there were 7 cases of influenza in Manitoba, 7 cases in all the entire season. This speaks to the power of staying home when you're sick, covering your cough, washing your hands frequently, and wearing a mask. 31.5% of Manitobans received the seasonal influenza vaccine last year, compared to 26.3% in the 2019-2020 year. This is a significant increase, and I hope we can achieve or surpass this year last year's percentage. Immunization against the flu has been shown to reduce the number of physician visits, hospitalizations, and deaths particularly among those who are at increased risk of serious illness from the flu. Getting the flu vaccine is the best way to protect you and your child or children against the flu that can often be serious and sometimes fatal. They help prepare your body to fight potential future exposure to the flu by getting your immune system ready. The flu vaccine helps protect you, your family, and other people in your community. As Manitoba works hard to protect itself against COVID-19, the healthcare system remains at risk from the Delta variant of COVID-19 as case numbers and hospitalizations are rising. Being immunized again this seasonal flu year protects yourself, those around you, and the healthcare system from increased hospitalizations and ICU admissions. Going and getting the flu vaccine is yet another way to help Manitoba fight against COVID-19. The public launch of the seasonal flu campaign is being finalized and will be announced shortly. Thank you, and I could take a few questions now.
Thank you, Dr. Atwal. A reminder to our reporters on the line, you'll have one question, one follow-up, and if time permits, we'll go to a bit of an open session at the end. Starting today from Radio Canada, Charles.
Hi, Dr. Atwal. At national level, new cases of COVID-19 are trending downward for the first time in months. Is this the case in Manitoba or not at all right now?
So nationally, the case numbers have been decreasing according to the latest reports. In Manitoba, week by week, we have seen a slight increase in cases. And obviously, there's more cases now than there was 2 weeks ago or 3 weeks ago. And we've had a little bump up in the rolling 7-day average as well. So we are still trending up in case numbers as well. We're keeping a very careful a look at the situation as well. The vast majority of our new cases are in those who are unvaccinated. And again, the vast majority of our hospitalizations and intensive care unit admissions related to COVID-19 are related to those that are unvaccinated as well. Again, that speaks to the power of the vaccine and what it can mean to you and your family, to your community, to prevent cases, which in turn prevents hospitalizations, which prevents ICU admissions, and it prevents deaths as well.
Thank you. And some experts are saying that major ventilation upgrades might take years to complete. Do you think, Dr. Atwal, that it could be problematic for the health of Manitobans?
So we've always looked at different levels of evidence, and ventilation plays an important role in the transmission risk related to COVID-19 and other viruses as well. There's obviously a number of mitigating measures we put in place to reduce the transmission within indoor places as well, including masks. We have the recommendations on hand hygiene, being at home when you're sick as well. So there's a lot of measures in place there to reduce that risk indoors. And as information and evidence continues to evolve, we'll continue to look at that evidence to make future recommendations as well for Manitobans.
Thank you.
Next from CBC Manitoba, Bart.
Hey, Dr. Atwal. Okay, so explain this to me. Why Southern Health when we have an even higher infection rate right now in Northern Health? Why not any additional restrictions in Northern Health?
Right. So we do have a one larger outbreak and one smaller outbreak in the Northern Health region. So obviously there's a lot of communities up there, a lot of land up there as well. So we do have a couple of First Nations communities that are experiencing an outbreak, which is really skewing test numbers because these are isolated, localized communities. So that's where, things like case numbers and test positivity, can look very skewed, and we need to interpret those numbers carefully depending on the population we're looking at in the geographic area and the setting. So in Southern Health, we're seeing much more of a diffuse nature of cases throughout the region. So that is a stark comparison to what we're seeing in Northern Health region.
Now, you stated there is high community transmission risk in Southern Health, not just case counts. That's led to this additional measure. Can you go into details into the compliance that you are seeing to the standard isolation rules and other compliance rules, other standard COVID fundamentals, as you guys call them, down there in Southern Health?
Right. So obviously in Southern Health, on a rate basis, we're obviously seeing a lot of cases being generated. we're seeing hospitalizations and ICU admissions coming from all over Manitoba, but it is skewed a little bit more to Southern Health as well. We have had situations where there have been issues with case and contact management in all regions, but in particular, we've heard more issues related in the Southern Health region as well. I think there's been, the number of new admissions into hospital or ICU where someone's first test occurred when they came to the hospital is a little bit higher with those individuals from Southern Health. What we're seeing cases generated throughout Southern Health, and we're working with the region, we're working with stakeholders on the ground to work at understanding and working with public health in relation to the public health measures. We're also working with them in relation to vaccine uptake. So we're working with a number of partners to increase that vaccine uptake, because that is the best way to mitigate issues related to COVID-19 case generation, obviously subsequently hospitalizations, ICU admissions, and deaths as well. So a tremendous amount of work is being done there, and the vaccine uptake in Southern Health is lower compared to other regions as well. So that plays into that risk as well. So taking all those things into consideration, we needed to break transmission chains as much as possible within that region. And hence we made some stricter measures in regards to case and contact management. It's kind of like where we were at before for the province, but this is going to be specific to Southern Health and how we manage cases and the recommendations from public health.
Thank you, Doctor. Moving now to Canadian Press, Steve Lambert.
Hi, Dr. Atwal. Regarding Southern Health, the statistics out today show that the number of active cases in Southern Health exceed those in Winnipeg, any other region, including Winnipeg, which has about 3.5 times the population. So how bad is it in Southern Health? What's the test positivity rate there? And how many outbreaks are you looking at, or is it just a generalized spread?
Right, so obviously, again, on a rate basis, case numbers are higher. You pointed out quite correctly that, the number of cases on a population level are even higher in Southern compared to any other region in Manitoba. The absolute number of cases is far greater than what it is in Winnipeg as well. So obviously that means there's a lot of transmission there. There are some localized outbreaks that we've seen there in different communities, but there's also a general spread of the virus within the area as well. And some areas more problematic than other within a larger geographic location like Southern Health as well. So we haven't provided test positivity numbers because, again, data has to be interpreted properly. And just as we talked about the NRHA today in case numbers, we don't want to, have some skewed information out there. We want it to be evidence-based, and we want to not isolate communities and people too much as well. So from a public health perspective, we're looking at providing more information to the public where it's needed. But obviously, we put some greater measures in place in Southern Health because that risk is greater in Southern Health. And again, we need to break up as many transmission chains as possible. Hence, the measures in Southern Health will be increased in relation to cases and contacts.
And the new guidelines today for self-isolation, if I'm reading them correctly, in Southern Health, from now on, symptomatic people who have not had any known exposures must also self-isolate. So does that mean anybody with a persistent cough, for example, must self-isolate until their symptoms disappear or until they get a negative test?
Well, so it depends on your definition of persistent cough. So basically, if you go online, you do your screening tool. So if you screen in to get tested for COVID, so again, if you have a cough or fever, or malaise, any constellation of symptoms, the recommendation is to get tested. And if you're in Southern Health, if someone is symptomatic in your household, that means the rest of the household needs to wait at the household as well, not leave that house until that test result comes back. If it's positive, then obviously they continue self-isolating at home and await public health to contact them to continue on with case and contact management and advice. If that individual's test is negative, then that individual obviously stays at home who was tested until the symptoms resolve.
From the Winnipeg Sun, Josh.
Good afternoon, Dr. Atwal. Considering we're just coming through Thanksgiving, this is about the time last year when the second wave really hit. Are we expecting a large spike in COVID numbers 2 weeks from now? Is this what you guys are projecting, or were you hearing many issues about lack of compliance over the long weekend? What were you hearing? And what are the expectations 2 weeks from now?
That's a great question. It is sort of hard to anticipate where we're going to be at 2 weeks from now. Again, this all depends on the behaviors of Manitobans. So again, our recommendations were, from an orders perspective as well, if you're going to have households over, if any one person isn't eligible for the vaccine, you have to limit it to one household or 10 people outside. But if it was a fully vaxxed group that was there, then there would be no limits on it. So if people adhered, then the risk is very different this year. And obviously it's very different this year than last year as well, because vaccine wasn't available. This year, again, at this point, we've got 81.9% of our eligible population with 2 doses, 85.7% of our population with 1 dose that are 12 plus. And overall, almost 73% in all age groups who've had a dose. So that by itself provides a lot of protection. Public health has put in orders and measures in place to mitigate exposures and to mitigate transmission chains from generating as well. So there's a lot of adherence in Manitoba as well. So I think we should be looking good in comparison to last year for sure. But I do anticipate, our case numbers have been increasing week by week, that our case numbers will likely continue to increase week by week as well. I'll have a close eye on that. I can't predict exactly how significant interactions on Thanksgiving would have in 2 weeks in regards to case generation. Again, it all depends on interactions people had and how well people adhered.
And I know you're not in your COVID updates giving specific numbers when it comes to the number of cases where we have a death where somebody has been fully dosed. But do you have an overall total of deaths that have been fully dosed? So if you're giving the overall total, it's not necessarily identifying somebody who died that week, but that overall total. I know you're trying to protect privacy, but do you have a number of those breakthrough deaths since we began administering the vaccine?
I don't have that number in front of me, and I'd have to go back and check it. And from a public health perspective, we'll have to decide if we're going to be providing that sort of number in the future.
Moving now to Michelle from CTV.
Hi, Dr. Atwal. You're talking a lot about breaking transmission chains. And so I wanted to ask about rapid testing, and specifically in private settings, like if I'm going to have people over. Another example is if I have a symptomatic child, why doesn't the province make rapid testing more available just to the general public? What's the reason behind that? I know they're not perfect, but can't they still stop transmission chains some of the time? And isn't that useful?
Yeah, when we're looking at testing has to be done in a certain way. There's a lot of strict requirements into testing. Otherwise, you end up with what's called false positives, false negatives. We have laboratory trained personnel doing the testing. There are greater issues with rapid testing than there is with PCR testing as well. The best way, again, in the examples you cited, is if you have a sick child, they should have a PCR test done, not a rapid test done. If you are looking at having people over, ensure that they're vaccinated. Make sure you and your community members and the people you're interacting with closely are vaccinated to help not only, again, protect yourself, but protect them, protect your family, protect your community, and protect Manitoba's acute care system. Because Manitoba's acute care system is impacted by not only COVID, but everything else that happens. So the best way, again, to protect Manitoba is to get vaccinated.
Okay, I have another question here for you. Just let me get it up. As of October 31st, the fully vaccinated deadline approaches. Do you have any idea on how many frontline workers are unvaccinated?
At the present time in Manitoba, I don't have that number. I believe those managers and employers involved in that are still obtaining those numbers. I don't have those numbers.
And now we go to Skylar at CJOB.
Hi, Dr. Atwal. I have a question about how we view case numbers these days. I was just thinking back to last Thanksgiving when things really started going up exponentially and the case numbers were what we kept an eye on. It seems that you've acknowledged the case numbers are going up and it sounds like you expect them to continue going up, but there doesn't seem to be a ton of urgency. Is that because of the availability of vaccine and it's more about those severe outcomes in healthcare systems right now?
Yes, basically when we're looking at COVID-19, it's one thing getting an infection. The real impact is when it overwhelms our acute care system, with hospitalizations and ICUs, admissions and deaths. And since last year to this year, I mean, the one thing that has significantly changed is 81.9% of Manitobans who are eligible have received 2 doses of a vaccine. And from what we're gathering from information from our ICUs, we're not really seeing any people who were doubly vaxxed in our ICUs. And we're seeing that in other regions as well, in other countries. So that really provides a protective measure for our acute care system. We also know when we're generating cases, we're still going to get hospitalizations because there are a number of people who are at higher risk or older age who are more likely to be in hospital if they're unvaccinated. Obviously, those cases increase the risk of a hospitalization. We're also going to see cases, greater number of cases in younger people as well. And that'll cause some more hospitalizations, but not to the same extent as older individuals who aren't unvaccinated. So we're looking at everything. We're looking at our case numbers, the age ranges of those cases as well, the locations of the cases, the vaccination status of those cases as well. And we're looking at our acute care system. We're looking at length of stay, which has an impact on hospital capacity as well, as an example. And we're looking at hospital capacity, which, shared health is trying to increase capacity and build capacity on. So we have meetings on a regular basis with medical leads. We have a regular meeting as well with the acute care system, and we talk about capacity. We talk about where we're at. And from a public health perspective too, we have significant measures in place, real significant measures in place that really allow most of the mingling to occur between people in vaccinated individuals. And so, we're still going to continue to follow the numbers and determine that risk for Manitoba. We're going to continue to look at modeling as well and see where that takes us as well. But Manitobans still need to limit those interactions, need to limit case numbers, and still need to listen to the messaging from public health and to the measures related to, hand hygiene, wearing a mask, following the orders, and if you're sick, stay at home and get tested. Those are still very, very important. And in a time when influenza starts coming up, and we're going to start seeing influenza cases as well, that's going to put a greater strain on our healthcare system. So we'll be closely watching that as well.
Thank you for that. And we've heard several times now from some listeners who have concerns about some vaccine clinics, pop-ups and otherwise, I think, too, where ID isn't required for the folks getting their vaccine. And they brought up the concern, well, how do we know, what shot number this is for this person? And how do we keep track of all those important metrics when you don't even have to have identification to get the shot?
I haven't heard any issues related to that particular question you pose, and that could be a question posed to the vaccine task force as well. They might have a better lens on that. Obviously, we provide vaccines to everyone. There are some issues sometimes, I know, with some individuals with identification, but we have access to, clinical records, e-chart. We could find some identifiers, and we could put that information in place as well. I'm sure there is, some anecdotal issues as you've described, but I think in particular, anything specific to that, I'll have to leave to the vaccine task force because they would have a better lens, a better line of sight to that particular problem if it does exist.
Thank you.
And thank you. Now we move to global and Brittany.
Hi, good afternoon, Dr. Atwal. We've heard from some people some concerns now with getting the 3rd dose, and we're just wondering how that's going to affect people's vaccine cards and immunization records. Will they be issued new cards? Is it just going to be updated? And how will they be able to access that?
So those who are looking at the 3rd dose for the COVID vaccine, I mean, there's a particular group where that is available too. That obviously will be recorded in your health information, but it doesn't impact anything related to gaining access to venues or travel. but that information is stored under your personal health record. So new cards won't be issued. I mean, it's all electronic. So those who get that third dose, we're offering third doses to those who are at great risks and to try to protect our acute care system. So it's really to protect those individuals from an infection, from a severe outcome, and to ensure that our frontline workers who are in healthcare are protected against COVID-19.
Thank you. I'm just wondering about testing capacity and turnaround time right now, obviously going into flu season with more people going getting tested who are symptomatic. What are we looking at right now for the testing capacity that we can continue to have on a daily basis in comparison to what we did last season, and what that turnaround time is currently?
So, from a testing perspective, I know we are still within our range, our maximum range from a testing standpoint, from a capacity standpoint. As test numbers increase, so our testing turnaround time decreases. And I'm just trying to see if I have the testing turnaround number in front of me. I don't have it in front of me, but we could provide that number to you. I know as of yesterday, I think we just did over 1,900 tests. So, testing volume is there. Some days we reached higher numbers compared to that, even over 3,000, I think it was last week. So our testing capacity is there, and we're going to continue to monitor that and follow that as well. And as our, obviously, when our testing numbers increase, our turnaround time increases. Last I heard, and this isn't today's number, but we'll get you the most recent number, we're well within the 48-hour time frame. I believe we were just over 24 hours was the last number I heard, but that would have been a last week number. So we'll have to get that newest number to you, and our communication side could provide that number to you later on.
Thank you, Doctor. Moving now to the Brandon Sun and Drew.
Thank you. Dr. Atwal, you were speaking a little bit earlier about flu counts, and they were obviously very low last year. And this year, we're still going to be wearing masks, still have some public health measures in place. So what's the province expecting in terms of flu season? Will it be lower, or will it be more akin to a quote-unquote regular year?
That's a good question. That's a very challenging question to answer. The same mitigating tools that we're using for COVID-19 works for influenza as well. The one difference is, vaccines and vaccine uptake, with COVID-19, the vaccine uptake it's been stupendous, and we're expecting it to continue to increase, but our flu vaccine uptake has never been that high. Without, last year we had a lot of measures in place as well. We actually had lockdowns, which really limited the interactions between individuals. And schools, schools basically, went on remote learning for periods of last year as well, which caused a lot of transmission chains and risk to decrease as well. We know this year with the measures in place, we know it's going to have an impact on influenza, but we know we're also going to allow a lot more interactions to occur. Now, those interactions will lead to transmission of other viruses, such as parainfluenza or RSV and influenza as well. But we haven't been able to determine from a modeling perspective the impact of that. The whole world, where we usually get data from to look at influenza, had been impacted by COVID-19 and had restrictions in place. So we usually learned, or what we did in the past was we learned what happened in the southern hemisphere and kind of applied it to the northern hemisphere. But because the southern hemisphere was essentially locked down as well and had a lot of measures in place, their influenza seasons didn't occur last year either. So we can't use that as a tool or an education tool for us to kind of learn about what would happen this year. We've already had one influenza A case this year that I'm aware of in Manitoba. That's the biggest that we have. And influenza typically doesn't peak until December, January. So we're going to keep an eye on what happens, and not only in Manitoba, but in other jurisdictions where, they experience winter a little bit sooner than us, let's say, and learn from those experiences and understand what's happening. But we do anticipate cases occurring related to influenza. We do anticipate some hospitalizations, the extent of which we don't know. And we're looking at trying to incorporate that in modeling, but we haven't been able to when we're looking at what other jurisdictions have done for modeling for this. And to the best of our knowledge, the jurisdictions we spoke to don't have modeling for influenza at this point either.
Okay, thank you very much. Also, today and most days, we do see some breakthrough cases where fully vaccinated people are coming down with COVID. I'm wondering if the numbers we're seeing so far are what the province has expected, and whether the breakthrough cases themselves are concerned at this point.
Yeah, so it's not unexpected to see breakthrough cases. I mean, even in a vaccinated individual, the vaccine is not 100% effective. We've always spoken to that. So the more interactions people have, the more at risk they are of coming into contact with COVID-19. So even in a vaccinated individuals, obviously we're going to see some cases. So I don't think it's unexpected, the numbers that we're seeing, and they fluctuate day to day as well. So we have to keep that in mind. I think we're going to learn more over the next few weeks as well. What's most important though, is we're not seeing the severe outcomes related to those who are vaccinated. And that's the key thing. That is the most important thing here, is to reduce the risk of hospitalizations and ICU admissions. So even in those who are duly vaxxed, even if they get COVID-19, they don't tend to get typically a severe case of COVID-19 causing a hospitalization, even if they are older and even if they have underlying health conditions as well. So we're not seeing that here. It's not 100%, but the vaccine effectiveness and efficacy related to that is really, really high. And we're seeing that in other jurisdictions as well. And that's key to protecting our acute care system.
Closing things out today from the Winnipeg Free Press, Danielle.
Hi, yeah, good afternoon, Dr. Atwal. So today we're reporting 7 deaths from the Southern Health region, and that happened over the weekend. Based on what you're seeing in cases from that region, should the public expect to see more deaths over the coming weeks?
Well, yes. I mean, what we're looking at is increased transmission, right? We're seeing rates of infection that are really high in that region as well. Disproportionately, the cases are there. Disproportionately, we're seeing hospitalizations coming from Southern Health, Santa Sud, and disproportionately, we're going to see fatalities from there as well. It all goes hand in hand with viral transmission. So that's what we're trying to curtail with these newer measures in place, and that's what we're trying to curtail with the orders that we have, is to really mitigate and limit interactions of those who are vaccinated and unvaccinated, and to promote vaccine uptake, and to put measures in place to reduce the risk of transmission from one person to another person, one family to another, one community to another as well.
On October 18th, we begin doing surveillance screening for people working in vulnerable sectors, especially in the Southern Health region. Do you expect to see a lot of positive results come out of that screening system?
Well, so that's a challenging question to answer as well. It's going to be hard to know. We haven't done that much screening related to rapid antigen testing. We have done it in certain settings like PCHs that were part of a pilot study as well. And the number of positives wasn't that high. Now, we do look at screening as well for hospital admissions, and obviously those are higher for various reasons. But we are, in the Southern Health region, we'll likely see greater numbers of rapid antigen positive tests compared to utilizing those tests in other settings and other situations outside of Southern Health, simply because we do have a lot more cases, a lot more community transmission within that region.
Thank you. We do have a few minutes left for a bit of a round table. If there are any other questions, please proceed.
Dr. Atwal, Josh Aldridge, Winnipeg Sun. Just something else on the flu. You're talking about how it's difficult to really tell the impacts of the flu season, what we're going to see here, but are you able to really look at the type or the strain of the flu virus, how serious it's going to potentially impact somebody who does get the flu? Do you have any read on how this flu virus would compare to previous years?
Well, again, that's challenging to answer. It all depends on which flu strain is coming through the Northern Hemisphere in Canada and Manitoba specifically. So right now, our flu vaccine incorporates 4 different types of influenza that it protects you against. So it has 2 type A's and 2 type B's, so an H1N1-like strain, an H3N2-like strain, a Washington 2019 strain, which is a B strain of influenza, and another B strain, which is the Phuket 2013 type strain as well. So, those will protect against those specific strains. There might be some extra protection related to like strains as well. But again, without it's hard to predict that future, knowing what strain is going to circulate through. The strains that we looked at incorporating into the flu vaccine, there's national and international task forces that look at, what potential viruses will be circulating, and flu vaccines are developed according to that with all that data that they have. We do know that, flu vaccines against the circulating strain is 50 to 70% effective in reducing the number of cases, which in turn reduces the risk of hospitalization and ICU admissions related to influenza as well.
Dr. Atwal, it's Michelle from CTV. I'm wondering if you have any updates on Kleefeld School. We've heard some tips that there's several cases, up to 10, but no outbreak has been declared.
Sorry, I don't have the particular details of that outbreak.
Dr. Atwal, it's Brittany from Global News. We're putting in, I wouldn't say restrictions, but more into Southern Health today for those who have symptoms. We put in further restrictions last week. We're not seeing vaccine uptake really go any bit higher in the Southern Health region. What other tools do we have left if these actions don't continue to work?
Well, and there are still some slight modifications of public health orders that could be entertained. That's number one. Number two, we're going to continue to focus on education, working with community leaders, working with education, even at the individual level, one-on-one with members who are unvaccinated as well. So there's a lot of work still being done on the ground to look at vaccine uptake, to promote vaccine uptake, to talk about the safety of it, the importance of it, again, not only to protect oneself, but also to protect, one's community and the province's acute care system, because you may not be impacted by COVID, but if some loved one needs a surgery done or a hip replacement or a diagnostic test, that will be impacted with impacts on the acute care system related to COVID-19 as well. We're going to continue to focus on, education, and again, working with leaders, and we're seeing some inroads there. So that's very good. And we're going to continue to push and work with those individuals, those leaders, to talk about hesitancy, to educate, and to try to get vaccine uptake higher all across the province.
Hi, Dr. Atwal. It's Danielle from the Free Press. Has the province sent any rapid tests to employers at this time?
I don't know the answer to that, and that's something that our communication side could find out the answer to. I just don't have that answer off the top of my head.
Okay, thanks. Do you know perhaps the estimate of the number of tests that may go out this week or later next week?
I don't have that number either.
Dr. Atwal, Bartley here. Do you have school vaccination numbers, COVID-specific school vaccination numbers yet?
Bartley, I don't have everything in front of me. I don't have everything memorized. I apologize, but I think we should be able to get that information to you folks later on today.
All right, thanks. No need to apologize. Doctor, I've been told by a credible source that the infection rate and test positivity rate rather in Southern Health is 9.4%. Does that jive with the figure that you have chosen not to release?
So on this here, public health has purposely not provided test positivity outside of the WRHA. I know there's numbers floating around. From a public health perspective, we're looking at this, and if we feel that it's important for the public to be aware of these numbers at a smaller region level, then that's something that we will look at providing. But we're going to continue to provide information the way we are.
Why not important?
Dr. Atwal, is there a reason why you're not releasing a regional number, as Bart asked for, when in the past public health has released a district level number, a smaller number, in the case of Steinbach?
Yeah, we've done some things in the past and when we put restrictions in specifically in a smaller area there, I believe, and we had spoken about that because it was important to know. I think at this point, again, to universally do something, we're going to have to think about the risks related to this from a communications perspective, from a perception perspective as well, from an understanding perspective. So we've always done test positivity a certain way with Winnipeg and Manitoba. We're going to continue to do that if need be, where we feel like it's in the public's best interest or that we have to provide that information, we will. But we are actively looking at this right now. And if we do decide to do something different, obviously you guys will be, and everyone on the call here will be the first to know.
What's the
risk
risk
there,
of
Doctor?
the risk of doing, what's the
the
danger
risk
of
there?
not letting the public know?
Sorry, there was two people talking. The last person who spoke, can you ask that question again?
What is the actual risk? You said that there are risks there and it's not important to know. You can already tell by the infection rate that Southern Health and Northern Health have 6, 7, 8, 9 times the infection rate of Winnipeg, respectively, over the last week. So what is the risk and communication risk, and why is it not important to know that number right now?
Right. So, I think from a public health perspective, we always don't want to ostracize certain areas or certain communities or certain groups of people. So we want to be careful about that as well. And again, we've always provided information a certain way, and this is a collective way we've done things and organized things from a public health perspective. It's not me unilaterally or Dr. Rootson doing this on our own. We have a team here that we work with. And again, our team is looking at this right now. And we're determining what is the best road going forward. And again, if we do look at changing that, we will provide that information to everyone.
And that's as
Dr.
probably as
Atwal.
good a place as any to leave it today, folks. Thank you for your time, Dr. Atwal. Thank you all for your questions. This concludes our media briefing.
Thank you, everyone.